Hello everybody, welcome to my YouTube channel, Homeopathic Super Sessions by Dr. Jagose. Today I'll be doing an important topic from Organon textbook, that is the one-sided disease. So one-sided disease, this video, or rather the series of this video has been divided into 6 parts. Each part will tell you something about the topic, and I hope you all enjoy it, and I hope it will be beneficial for all your examinations. So now let us see what this video has to tell us today. So today I'll be discussing one-sided disease of an internal kind, the first part. So according to the Organon text, we have to see what has given. So it is given in aphorism number 172 to 210. So basically the basic definition is given in aphorism number 173. So Hahnemann defines it as one-sided diseases are those diseases which exhibit only one or two principal symptoms. That means only one or two symptoms are of importance, or they are the main symptoms and they are expressed. All the other symptoms are totally obscure, or they are unclear. They are not well defined. They are ill-defined. They belong to the class of chronic disease and they are difficult to treat. So naturally, the disease which progresses for a prolonged period of time, that automatically goes into a chronic disease. And therefore, if a chronic disease is there, which has only one or two symptoms of importance, and all the other symptoms are ill-defined or obscure or not well-defined, naturally, it becomes difficult for the homeopathic physician to treat. So therefore, please remember the 4 important points are that one-sided disease should have only one or two principal symptoms which are expressed. Other symptoms are obscure. They belong to the class of chronic disease and they are difficult to treat. So now let us see the classification. So according to the Organon textbook, one-sided disease is basically classified into 2 large groups. That is of an internal kind and of the external kind. Internal kind information is given in aphorism number 172 to 184 and external kind in aphorism number 185 to 230. Furthermore, the external kind can be divided again into 2 parts, the physical and the mental. Physical again subdivided into 2 parts, local maladies and or surgical disease given in aphorism number 185 to 187 and local disease given in aphorism number 188 to 209. Also out here, you are getting the treatment of the chronic disease, which is given in aphorism number 204 to 209. And of course, you have the mental disease 210 to 230. So this is how Dr. Hahnemann has classified one-sided disease. So in your examinations, in the vivas, they can ask you, what is the classification of one-sided disease? So you can remember this chart. Or they can ask you a long question, describe or define one-sided disease and tell the treatment either of an internal kind, external kind, local malady, local disease, or the different types of mental diseases. So please remember the classification, it is of importance. So now in this video, or in part 1, we'll only concentrate on one-sided disease of an internal kind. That is given in aphorism number 172 to 184. So examples given are that it may be a headache of many years duration, or a diarrhea of long standing, or an ancient cardialgia. Cardialgia meaning a chest pain. So he is given the examples of a headache of a long standing, diarrhea, or chest pain, or ancient cardialgia. The physician at times cannot perceive the disease in its whole extent with accuracy. So naturally, as you all know the definition, it only exhibits one or two principal symptoms and it obscures almost all the others. So therefore, naturally, the physician at times will not be able to perceive it clearly in its whole extent with accuracy. In order to be successful, one must select the medicine guided by these few symptoms which is most homeopathically suited according to our judgment. So whatever we have in our hands or whatever we have perceived, we have to then make good use of it and we have to prescribe. You cannot tell the patient that you don't have any characteristic symptoms, I cannot prescribe, you go away. So whatever you have according to your judgment is correct. Whatever symptoms you have taken, you have to form the totality. That means what? Whatever symptoms are there, you have to make best use of it in order to prescribe. They may be characteristic or they may not be characteristic, but you have to try to identify at least one or two characteristic symptoms in the case. This will be done according to the strict observance of the homeopathic law. So naturally, you have to choose a remedy according to the homeopathic law, that is similia similibus curenta, and you have to find out the totality of the symptom. Thus, a similar arterial disease will be created, which will annihilate the disease. So once you have taken the totality and you have prescribed it, you have prescribed the remedy to the patient, then naturally a similar artificial disease will be created, which will annihilate the disease completely. Now, Dr. Hahnemann says, this will be achieved if the few symptoms chosen are very striking, decided, uncommon, peculiar, distinctive, and characteristic. So Dr. Hahnemann says that whatever symptoms you are chosen or whatever drug you have given, it will annihilate the disease, provided you have chosen the symptoms which are very characteristic, uncommon, peculiar, or distinctive in nature. The cross-reference is episode number 153. The same thing has been mentioned out there also. So the first medicine chosen will be only partially suitable to the case. So please remember, this annihilation will only take place provided the symptoms are striking, decided, uncommon, peculiar, distinctive, and characteristic. But according to the definition of one-sided disease, it has only one or two principal symptoms and it obscures almost all the others, or the other symptoms are obscure or they are ill-defined. So therefore, in such cases, the first medicine chosen will be only partially suitable to the case, as there was no considerable number of symptoms to guide to an accurate selection. So in a one-sided disease where you are only getting one or two characteristic symptoms and other symptoms are not or they're not well perceived by the physician because they are ill-defined, not properly defined, or they are hazy. So naturally, the first medicine will only be partially similar. Thus, the imperfectly selected homeopathic remedy will act on the disease that is only partially similar to it. So naturally, if you've chosen a medicine based only on a few characteristic symptoms, then that medicine which you have chosen will not be considered the simillimum, but it will be considered as a partially suitable remedy to the case, or an imperfectly selected homeopathic remedy. So what happens when an imperfectly selected homeopathic remedy is given or a partially similar remedy is given to the patient? So three actions will take place. First, it will produce accessory symptoms, that is symptoms of the drug, and will be mixed up with the symptom of the disease itself, although they may have never or been very rarely perceived. So the first probability is that you will get accessory symptoms. That is whatever symptoms of the drug are there, they will also be expressed if the patient is sensitive to it. Secondly, some symptoms which the patient had never previously experienced appear. Or secondly, some symptoms which the patient had never experienced in his life, they appear. And thirdly, other symptoms which he had only felt indistinctly become more pronounced. Or thirdly, as you all know in the definition, the other symptoms are obscure. They are ill-defined. They are not well-defined. So those symptoms which were indistinctly felt become more pronounced. For example, the appetite was less. Now, after the selection of the impartially similar remedy, appetite has improved. In his sleep, the patient used to get frightful dreams. Now, the frightful dreams are much less. Patient used to perspire on the palms and soles. Now, after this medicine, patient doesn't perspire. So these are the symptoms which are felt indistinctly become more pronounced. That means what? The symptoms which were incomplete, they become complete. The symptoms which are hazy, they become distinct. Symptoms which were ill-defined becomes well-defined. So 3 probabilities. Number 1, accessory symptom, that is symptom of the drug. Second, whatever symptom patient had ever experienced in his life, it appears. And third, the indistinct symptoms become more distinct. Now we have to regard the whole collection of symptoms now perceptible as belonging to the disease itself. So when we have given an impartially similar remedy, whatever changes have occurred, it has to be taken as a whole, as the actual existing condition, and to direct our further treatment accordingly. So whatever changes have taken place after the administration of the impartially selected homeopathic medicine, we again have to retake the case, and we have to see what does the imperfect selection of the medicine due to limited number of symptoms present serves to complete the display of symptoms of the disease. So what happens? The imperfectly selected medicine will help to complete the display of the symptoms of the disease. In this way, it facilitates the discovery of a second, more accurate, suitable homeopathic medicine. So naturally, when some changes have occurred, the totality has changed. So you again retake the case, you reframe the totality, and this way you will be able to discover a second, more accurate, suitable homeopathic medicine. Therefore, when the dose of the first medicine ceases to have any beneficial effect, a new examination of the disease must be instituted. Dr. Hahnemann further says that if you have given the first medicine and the dose ceases to have any beneficial effect, then you have to again re-examine the case. So, and also note down the status morbi. Now, the second homeopathic remedy is selected in accordance to it. So, when the case comes to a standstill or the case doesn't improve after giving the first medicine, you have to retake the case, reform the totality because the first medicine was imperfectly suitable to the case, or it was only partially similar to the case. So as I told you, when a medicine is partially similar, three reactions are possible: accessory symptoms, which patient has never seen in his life come up, or other symptoms which were indistinctly perceived become more distinctive. So therefore, you retake the case and you try to find out the second most probable good homeopathic remedy. In this second homeopathic remedy shall exactly suit the present state, as the group of symptoms have become larger and more complete. So as you all know, after the first prescription or after giving the first medicine based on few symptoms, some changes in the totality have taken place. Retake the case, find out the suitable second homeopathic remedy, because out here you're getting more large group of symptoms in order to prescribe. Thus, in a like manner, after each new dose of medicine has exhausted its action, the state of disease that still remains is to be noted anew with respect to the remaining symptoms. So in a likewise manner, Dr. Hahnemann has said that after each dose of the medicine has exhausted its action, then you again have to re-examine the case, see whether the previous medicine still holds good to the new totality. If it still holds good, you give the old medicine. If not, you have to prescribe a new medicine based on the modified totality. So in this way, you have to go on treating the patient until the cure will take place. Hence, another homeopathic remedy is indicated. In this manner, it should be done until recovery is complete. So that's all for the internal kind. Please stay tuned for more. The second part will be coming up. I hope you enjoyed this video. Thank you very much.